Okay. Hello, all. A very warm welcome and thanks for joining us today. It's my privilege to welcome you all to the 8th Global Coalition meeting. We would like to request everyone to maintain respectful and safe space for everyone. So let's be mindful of language we use and how we interact with others. So this global coalition, it's an initiative by Enfold to create a platform where people from different organizations and also individuals from different locations can come together and discuss the under discussed issues related to sexuality, gender, and personal safety of children and adolescents. The objective is also to create a common vocabulary and understanding of these issues and advocate for changes in their own spaces. In this meeting, we will be bringing the focus on sexual abuse of children and adolescents with disability. This remains one of the least spoken yet most pressing child rights issue. Children with physical, sensory, intellectual, psychosocial disabilities often face multiple layers of vulnerabilities, which perpetrators exploit. This meeting seeks to address this issue not only to understand them, but to transform awareness into action. By engaging with our diverse panelists from different countries and different experiences. On this note, I'd like to introduce our moderator, Ms. Vaishali Pai. Ms. Vaishali is a distinguished occupational therapist with over 35 years of expertise in childhood neurological conditions and developmental disabilities. She is the founder director of Tamaha Trust, a pioneering organization in Bangalore dedicated to provide holistic, child centric therapy and comprehensive support for children with developmental challenges and their families. And also, she is a gold medalist from Mumbai University. Ms. Vaishali brings multidisciplinary specializations, including neuro linguistic programs, early interventions, and support sports therapy. Under her leadership, Tamahar Trust has become a model of joyful, family inclusive care, combining therapy, advocacy, and capacity building to create sustainable impact. Driven by a deep commitment to dignity and inclusion, her vision continues to shape empowering ecosystems where children with disabilities and caregivers can thrive. Once again, thank you all for being a part of 8th Global Coalition. Over to you, Vaishali.
Thank you, Anala, and for that very effusive introduction. Thank you, Enfold, for having me here. It's a pleasure. And thank you for giving me such a wonderful panel. It is very exciting for me personally to be able to moderate this, to talk to all these experts. And I'm looking forward to all the insights that they can give. So just a little bit before we get into the actual panel, uh, good morning, good afternoon, good evening from wherever you are around the world. Welcome. Namaste from India, from Bangalore specifically from me. The housekeeping rules have been set, but I just wanted to put out some of the things that kindly keep yourselves on mute so as to not disturb the speakers. But make sure that you jot down all the questions that you might have because we're going to open it for everybody at the end of the panel. So we have 5 speakers today, and we're going to hear from each one of them who specializes in their respective fields. So just to set a tone for today's conversation, I wanted to, from my part, put this out that abuse is not gender related. So many a times when we are looking at, and it happens all the time, of course, women are targeted much more. But we should bear in mind that there are other genders as well who also suffer from abuse. And it would, when we talk about abuse and disability, we are non genderic at the moment. So that was something that I thought we should put out. The other thing is that, from my perspective and my experience, what I have understood is that disability especially creates a lot of problems for when it comes to abuse. And there are two things which I feel which are very important that we must keep in mind is that maybe, just maybe, people from this particular population could find it difficult to realize what actually is can be termed as abuse. Very often we know that the perpetrators are someone very close to us. And if people with, let's say, intellectual disability, for example, find it difficult to even realize that there is some abuse happening, it can lead to a lot more difficulty, not only for the person, but also for the caregivers. The other issue could be that uh, uh, the said abuse could be difficult to inform to the caregivers or the people around you who care for you because of communication lapses or gaps. And so my thoughts are that if there is distress, then we should uh, realize that and start investigating. But I don't, this is not about me, so I don't want to go on about this. Before we get on to the four eminent women who have come over here, I feel that it is very important for us to listen from a beautiful young adult. And Sarita, it's such a wonderful thing to have you here. Anala, with your permission, I'm going to just read out about Sarita's accomplishments and then hand it over to you, right? So, 18-year-old Sarita lives in Switzerland. She has cortical dysplasia and epilepsy with left upper limb weakness and few cognitive challenges. Despite this, she's an achiever. She has benefited from her government special education, leading to being fluent in three languages. She enjoys singing, badminton, socializing, and much like a typical teenager with distinct preferences and a distinct sense of self, she has her own thoughts about sexuality and abuse. She advocates menstrual health awareness and access to products, and it has been a support to Enfold along with her dad. She believes that her family has been an immense support for everything that she has learned about sexuality, about abuse, and how to handle it. So over to you, Anala. Let's hear from Sarita.
Thank you, Vaishali. Hi, Sarita. Good to have you here. Here the
Mm,
question is, could you please
mm,
tell us about your getting your sexuality education at home and at school?
mm. So in a primary school, w- so there's something that you have to know is that we learn it in a progressive way. So in primary school, we talked about the circle of life. We also talked about the we also talked of my body, my rights, and about naming the body parts. For a girl of 7 years old, it was a bit uh, like nervous, like scary, knowing that one day you'll pass away. So it was something. It no. In middle school, we were all in puberty, so we were learning about puberty, sex, and and about being healthy. And sometimes it would be in two groups, separated by sex, and other times it was together. Some of the kids wanted to puke, but for me it was okay. In secondary school, we in secondary school it was in more detail because we mm, were more in a puberty, and so we learned about how to use condoms and pills. We also learned where to get them, how to use them, and they also gave us a link and a hotline called ciao.ch. And for me, it was, for me, it was good. It's how to, it's easier now because we are all some of them are even young adults like me, 18, others 17. The youngest is 16. So we are more advanced, and so it was much easier. And for school, no, sorry, and for home, and part of the things that gave us the school was to have police officers come and talk about like the rules of the intimate pictures of what are the rules of taking them. Like, for example, you could take them, but just do not show them to your friends, even though you think your boyfriend or your girlfriend are beautiful. That's the first thing. And if you break up, you have to take out all the picture because otherwise it could be considered as sexual abuse. And also to ask permission for even gentle touches like hugging. That's something you have to ask. And at home, I was in and out of hospital, so from a young age, I was interested in the human body, and so at 5, I got my first book, The Care and Keeping of You, for younger and older girls, and the and what also helps is that at home we talk about education of sexuality education with moderation, but we talk about it during breakfast, lunch, and dinner, but with moderation. I feel lucky to have an understanding family, and that I can talk to not just my parents, but also to my brother and his wife. And yeah, that's all.
Okay, thank you, Sarita. That's so lovely to hear your experience. Over to you, Vaishali.
Thank you, Anala. Thank you. That was wonderful to hear you, Sarita. I mean, you have had such a wonderful experience from your family with having open family conversations, having family members who would add to your learning. And what struck me, everybody, is the rules that have been written down for something simple, as in when to hug, when not to hug, whom to hug, and deleting the pictures if you happen to break up, and how beautifully that was explained. And Sarita, I mean, I love the Northern Lights, which which are increasing your wonderful halo, and has really entitled us. I mean, told us about how wonderfully they have been teaching you, and kudos to you to have imbibed everything that you have learned. So thank you for coming over on this panel and setting the ball rolling. I'm sure you would want to hear up with what others have to say. So people coming up, we have an absolutely wonderful speaker. She is here representing the caregivers. But before we go on to her caregiving duties, it's going to take me a long time. And I have hardly any time. So I've already gone beyond time, but I must tell you that she's a master's in public health, a diploma in ophthalmic medication. She has medicine and surgery, a consultant in the World Health Organization, has developed INU, multiple publications. I presented Dr. Binoo Nair to you. Welcome, Dr. Binoo. Sorry, I had to just cut everything because I was so taken up by
it's
Sarita.
perfectly fine. Even this is too much for me.
So, as we had discussed, I had some questions for you. And having heard what Sarita had to say, the first question that comes to you is, how does the fear of potential abuse affect you emotionally? And as a caregiver, as in your family life, what are the resources that you rely on for yourself? Because we will talk to you about your caregiving later.
Yeah. Okay, so I would like to tell you, like it is but natural that the disability itself affects you emotionally, big time. And then over that, to, look at the security of the child and the idea of potential sexual abuse keeps you vigilant all the time. And of course, it does take it does take an emotional toll. So, having said that, I think it is very important to tap into any resource available, which may mean your friend, your partner, your family, the school, the teachers, the secondary caregivers, like your helpers in the house, your the transportation people, everybody. And well, you have to overcome first your own grief, anger, and why me, and pick up your own self-esteem to help the child, so that the child's self-esteem is not also jeopardized. And having said that, well, keeping all the anger and frustration aside, we have to tap in every resource, in the sense that you first sensitize the family and make them your positive resource. Then your friends, then whoever your child communicates with has to be told very well that this is what it is, these are the boundaries, this is how far any caregiver has to go. Also, in my case, I always had, since I have a daughter who has had the problems. She had mental issues, psychosomatic issues, and also severe learning disabilities. So, she was very socially, or rather socially inadequate and inappropriate at times. So I saw to it that I create a bubble around her, a social bubble where she will feel safe. And I avoided taking her out to places which could be too challenging, so that she doesn't get nervous and she comes up. Most important thing is that more than the resource, you have to be very communicative with the child. One, even if it is 5 minutes, you have to keep a time every day to communicate with the child, to ask what she has gone through, and maybe tell her about the rights and wrongs, do's and don'ts, your own way. One doesn't have to be academic with the child all the time. You can cook up your own stories, like, what happened with one child, there's that, and what do you think the child could have, done, and just empower the child emotionally. Well, even now, when I was asked to uh, kind of talk about it, I had to walk back the road and to get back to today's session. It, for a while I felt like, oh, why I wish, I could run away from this. But having said that, let me tell you that I have gone through all the ups and downs emotionally. I've been helped. I've created resources for my own self, for my daughter's safety, and I think everybody can be helped with this. One thing I always did was I always had two lady caregivers at home with specific instructions to be around my daughter, whether especially when I'm not at home. There were always two people, and they were instructed that work or no work, sweeping, swabbing, mopping, or no sweeping, swabbing, mopping. You just have to feed the child and be around. I have more helpers than what I need, so that there's an influx of very safe and comfortable people in and out of the house. My helpers are usually like have been working with me from anywhere for 12 to 30 years in the past. So they know her very well. Another thing very important is, of course, communication with the child. See, I'll give you one example. Initially, like, we used to ask her to answer the door so that she feels integrated in the house. So there was this postman who came, and she took the package and he touched her inappropriately. She came in and she told her father that, Papa, this is the postman came and he touched me on my chest and I did not like it. So this kind of communication is most important with the children. And what did the father do? He said, very good, I'm very happy that you are able to tell me, and you've told me this, and you never let anybody touch you, and you never let anybody exploit you. This is not appropriate. He went to the post office. He found out which postman came home. He brought the postman home. He made her apologize to my daughter. And only then he let go of the postman. So not only she was kind of, she got validated that her feeling, her hurt, her, the bad touch was brought to a logical conclusion. And after that, I never saw stress lines about the issue. That thing was forgotten because she could handle it. And thereafter, whenever she found that somebody was a little inappropriate, she would come and tell her father, or she would come and tell me. So all these things are very important. But most important emotional part is that you have to be vigilant all the time. I don't remember when my husband and I traveled together. We always in one of us is always in town, unless there's somebody very responsible to be around in the house.
Thank you so much for those frank talk, for the frank talk, Dr. Binoo. This you actually have already answered my second question, because my second question to you was to be: have you faced any such issues, and how have you handled it? So you have already answered that, but I do have something else that I would like to ask you.
Sure.
I totally understand when you say that the sleeplessness, the grief cycle continues, it just comes and goes all the time. You mentioned sacrifices, you've mentioned having a bubble. do you feel that because of this fear, inherent fear, which is absolutely jayyz, is she losing out on something? Are you as a family losing out on something
See,
by
losing
creating this
out,
bubble?
yeah, losing out and not losing out is, I think, very relative. If I say that I had many opportunities to travel, I did not take it, so I lost out on travel. But then if I think that I am losing out, then I'm losing out. If I think, okay, this is my choice, then I'm not losing out. So, of course, one has to make, like, if I go to a restaurant, earlier I used to feel very sad that I, cannot maybe take Winnie out because, she cannot handle too much of crowd and all that. But later on, when she became a little more stable, she would go once, and the second time she would say, "Is why don't you go? I am not comfortable." So, that guilt part of it is taken care of. So, I don't, then in that case, I don't, since I don't feel guilty, I don't feel compromised. If I feel guilty, I feel compromised there. Like now, if I have to take her out, I'll take her out at about 7 o'clock when, there is not too much of, it's the place is not bustling with activity. She'll enjoy her meal and come back home. So these are minor adjustments. And it's just how you think, how you take it, because this is what you were served with, what the Almighty served you with, and you may as well, accept it and do it gracefully.
How wonderful a thought is that, Dr. Binoo. Yeah, so you have accepted it, you have accepted the
There's no
circumstances,
other
and
option.
yes, yeah. But do you feel that she will miss out on something? Or you have accepted that also? That yes, that
She
is
doesn't say, she's if she was lamenting that, oh, I want to do this, I want to do that, and I was not able to do it with her, then possibly yes. But she's
okay.
very content in her space, so I'm also happy and content.
Wow, thank you. Thank you, Dr. Bino. It was wonderful speaking with you. There were a lot of learnings. One of the first ones is how you accept is how you are going to go forward, and how your life is going to be. And I too hope that someday you'll be able to travel as a family. You did mention it yesterday as well, that you try and avoid it and don't go. And uh,
Because she doesn't
yes,
like to go in crowded
travel.
places,
All
and
right.
yeah.
All right. Got
But
it.
one
Got
thing
it.
I would like to make a mention, if there are parents listening to this, that Child Sexual Abuse Helpline 1098 every child should know. Every child. It is the
Yes.
parent's responsibility as a caregiver to give this to every child. They should have it like at the back of their hands. That if the parent is not there, they should be able to make this phone call. If they are that enabled, they should. Or the secondary caregiver, whoever is there, should know where to call.
Thank you. Thank you, Dr. Bino. Unfortunately, we would love to keep talking to you. Unfortunately, I'm so
No,
sorry.
no,
We have
it's
to move on.
perfectly fine. Yes,
Yeah.
please do.
Yes.
Yeah. Okay.
Yeah. So actually, Dr. Bino has summarized everything I had to say. Loved what she spoke about, how they have empowered their daughter to talk and to say out things. It was wonderful to hear it. We wouldn't want it to happen, but if it does happen to any child, then there should be this empowerment where the child is able to speak up, the child doesn't feel scared or doesn't feel guilty or doesn't have any of those negative emotions, which could naturally be associated with something that this toxic, right? So thank you, Dr. Bino, once again,
Thank you
and
very much.
we will move on. We are now going to welcome Dr. Sasha. She has come to us all the way from Philippines, and I think it is about maybe 2 hours ahead of us. So thank you for missing your dinner time for us.
Hi, from Malaysia.
Oh, you're from Malaysia. Okay, I was told Philippines.
Hi.
Sorry.
No worries.
Yeah, stand corrected. So Dr. Sasha is a pediatrician with experience in child health protection and advocacy. In a clinical role, she has chaired multidisciplinary case conferences on abuse cases to ensure coordinated safeguarding responses. She also serves as Vice President of Protect and Save the Children, PSC, an NGO dedicated to combating child sexual abuse and exploitation. PSC runs preventive programs in schools and communities, conducting workshops using its own personal safety program and Stop It, Be Safe modules. Wonderful. I love the name of those modules, including specialized training kits for children, youth, and those with intellectual disabilities. So Dr. Sasha is deeply involved in advocacy work and has spoken on national radio and in forums to raise awareness on child sexual abuse and exploitation. And we're going to hear from her perspective as from the social sector. So here goes, Dr. Sasha. My first question to you is: could you share examples of how your NGO builds the capacity of parents, caregivers, and teachers to recognize and respond to risks of sexual violence against children with disabilities?
Hi,
Over to you.
thanks for having me here. So as already mentioned, we have in PS the Children, we have quite good modules and programs that we run within the community. So an example would be our Keep Me Safe, and the one that's specifically tailored for children or families or schools who are handling children with disabilities. We call it a Stop It and Be Safe program. The main issue is we need to address the modules to help three groups, which is one, the children, then the parents or the caregivers, and finally the school teachers, because we know protection depends a lot on all three of them working together within the community that's closest to the child. So for children specifically, the modules are created when we are with them. We go through things slowly. We go through body safety. We talk about, we start from what is the image of themselves. We build up their confidence about who they are. We also build their confidence when it comes to what are secrets, good secrets, bad secrets, what are things that situations where when the feeling is not good, they must have the confidence when to say no. And then finally, within their support system, according to each age group, we are able to teach them who are their trusted adult to report to if something does happen to them. Older children, we are able to talk to them about what is available within the country itself, like do you go to the police? How do you get access to social workers? How do you get access to hospital doctors to bring up a story of abuse? There are now pathways where they can do it online or just make a phone call anonymously as well to ask, what do I do in such situations? So for specifically children with disabilities, especially when we address neurodivergence, any intellectual disability, we have to adapt the material for them. So we have materials that are like visual cards. We create role playing. We do it in repetition, and we give them scenarios and exploit together with them in close groups. So we teach My Body Belongs to Me. We use picture stories. We use usual activities like toileting, bath time. How do you address body safety in those situations? We want it to be concrete and safe. And we also prep the parents ahead that this is what we go through before we run the modules with the kids. For parents, we teach them about child rights. We teach them about child protection pathways. We teach them about signs and how to know whether your child is being groomed, your child is actually experiencing abuse. We tell them what is the harm that you can find online nowadays. And finally, what happens when you need to report it. We prep them ahead. When you see the police, this is what's going to happen. When you go to the hospital, what are the doctors going to talk to you about? So we are teaching them also how to communicate with the child that is trying to tell them that they are being abused or that they are in danger. So those are for specifically parents. It also extends towards teachers, but teachers, we are able to to help build their capacity of the workforce. We want to give them not just a template of how to create a child safeguarding policy within the school and referral pathways. We want them to take ownership and also to carry forward that safeguarding policy within their school, so that they don't just think to themselves that this is not my job, this should be a shared responsibility within the school or community organizations. Then only then people feel that when a case of abuse comes to me, I feel safe myself to make the report, and I'm also able to provide safety for the child. So when everyone works together and everyone understands the pathways and what services are available, what you need to prepare for on that path to save the child, we find that this is the best way for children to be protected, whether they are disabled or not disabled.
Absolutely, Dr. Sasha. I know, I mean, abuse is not only for disabled, it's just that, probably people with disability find it more difficult.
Yeah.
Thank you. Thank you for giving a very extensive and very structured answer. My second question to you is, if you could recommend one policy or program change to improve child protection for children with disabilities, what would it be? What could you suggest?
Coming from my experience as a clinician, as someone who has received reports and patients coming to my hospital as abuse victims, and also working from the community side through my NGO work, I feel that we need to make our entire child protection system disability inclusive. So what the problem that's happened now is, if you are a disabled child, you may find there are laws to protect you, but certain scenarios or situations actually cause them to, or there may be limitations that cause children with disabilities to fall through the cracks. You may find that there are frontliners who are not trained very well on how to communicate with children with disabilities. You may find that when the child victim tries to describe the story, if they're not able to give detail, like be accurate in what they felt, saw, or where the incident happened, their case is not taken seriously. And then some parents, they don't really look into the child's situation or their well-being. They will say, let's settle this quietly, or it's too difficult to prove the case, and that all will silence them. They will feel that their voices are not heard. So a truly inclusive system, we want it that children with disabilities are able to be agents of change. They themselves feel that I can come out and tell what is going on. I can influence law and policy. We also want interagency child protection case management. And we want the information that we collect to be also evidence-based and inclusive. Everyone has access. Everyone are trained on how to work with children with intellectual and communication disabilities. We want accessible tools like picture boards. We want sign language interpreters. We want multidisciplinary teams that have the information and they understand disability and trauma. Lastly, of course, we have to talk about services, counseling services, special education services. We want them to be tailored for children with different needs. So that's where I feel an inclusive system needs to be created. We need it to adapt to the child, not expect the child to adapt to our system.
Absolutely. Yeah. Sorry, I didn't mean to interrupt you. Please go on.
No worries. Yeah. So I think the only part that I would want to add is I'm very happy nowadays. I'm able to see more parents and teachers. More people are talking about all this. They are talking openly through social media, as well as they are contributing to communities. So when we build on the skill, and then we want more people to have empathy for the children who are victims, whether it's from the home situation all the way to how we create laws and policies, that's when we really can close the gaps and really help children with disabilities to prevent abuse. And also, if they just happen to be at risk or abused, they can come out and ask for help.
Yeah, absolutely. And kudos to you for your work. And we wish you get absolutely empowered to make this a national movement. I do want we just have 1 minute left for you. I want to
okay.
squeeze in one more question. How important is it to teach parents, and how do parents actually respond to the education that you would impart them about sexuality or sexual abuse, and what is the response in general? What is your finding?
So in Malaysia, we are it's the same as in India. We are multiracial. We have to be sensitive to what each family, their views on how much they really want their child to be exposed to education on sexuality and so on. So before we sit with the child, we always go through with the parents. This is our module, and our module is not like, whenever someone says sex education, they only think of what happens between a husband and wife, and that's what we're going to teach. But that's not what we go through. We want to tell parents that one, what are the dangers that are out there that you need to be aware of? What happens when you are not proactive in looking into this? Your child is going to learn this from their friends, from outsiders, and how you are going to be able to help them is by knowing how to be able to communicate with them is one thing, and to understand what are the outside influence that they are exposed to. And finally, we go through things telling what are child rights. We tell them that it's not about the details of what goes on in the bedroom. It's about your child knowing that their body belongs to them, what are dangerous situations, what are dangerous secrets, and when to be able to come out and tell parents, I'm in an unsafe place, you need to help me.
Yeah, absolutely. Absolutely, Dr. Sasha. The self-advocacy bit and the disability inclusive policy really struck a chord with me. Thank you for making time for us. As you can see, there are a lot of hearts going for you.
Thanks for having me
so
here.
it has been, yeah, it's been appreciated. Well,
Vaishali, you're on mute.
oh, sorry. I don't know from when I was on mute. I thought I had clicked it. Yeah, as I was saying, I thank Dr. Sasha. I hope she heard it. I said from Malaysia, now we are going to London, and with some more mind-blowing information. So let me bring to you Dr. Geetha, Dr. Geetha Ganluru, consultant child and adolescent psychiatrist. I'm forced to give brief biodata because we have just 1 minute to talk about them. Sorry about that. She's a consultant child and adolescent psychiatrist in the UK with over a decade of experience in specialized mental health services. After completing medical training in India, she pursued post-graduation psychiatry in UK, where in early placement in child psychiatry led to a focused career, which was lovely. Thank you for that. Since 2014, she has been working as a consultant with clinical interest in neurodevelopmental disorders, safeguarding, and trauma. She works in a generic community service, and she sees children with disabilities who are at risk or affected by sexual abuse with a commitment to trauma-informed multidisciplinary care. So there is going to be a lot that we are going to be able to hear from her. Thank you for being here, Dr. Geetha. And let's just jump in. Don't want to spend any more time. So the first question to you is, how might trauma symptoms in children with disabilities be misinterpreted or go unnoticed due to pre-existing behavioral or communication challenges? How would you be able to tell us more about this? Dr. Geetha, you're on mute. I think I've spread that infection. You'll have to unmute it, or should I ask the team? Yeah, there you go.
Yeah, thank you very much. Thanks for that introduction. And
I'm really impressed with Sarita, Dr. Nair and Dr. Mohan's talk. I don't know what more I can say other than actually generalizing it into my clinical practice. I think they gave a wonderful introduction to their personal experiences. And just to add to that, I think it's about understanding how you describe a disability in a child. I think children with disabilities are defined as individuals under the age of 18 who have long-term physical, mental, intellectual, and sensory impairments. So it's not just about a child who can't see, speak, or kind of have significant intellectual disabilities, but there are a spectrum which sometimes are not recognized and also misinterpreted. We'll come on to that in a minute. So these impairments, in conjunction with various barriers, may hinder their participation fully into the society on an equal basis like any other child. So that you can see from the early on there is some sort of a discrimination based on the assumption that that child can't participate fully. So there comes a misinterpretation, not because the children aren't able to express, I guess it's because the system they live in aren't able to understand their means of communication. A child's communication can be verbal and non-verbal, like all of us. And professionals working with children and caring for children in both health and social care systems, they find themselves in more complex situations than you would find professionals that work with adults who can advocate for themselves. And I think the difference in these situations is because children by nature are vulnerable and they rely a lot on the judgment of the adults who look after them or who are their caregivers. In general, involved in their care in many different aspects. That could be that's involving family members, teachers, friends, extended family members, and other carers, paid carers who look after them as well. So the misinterpretation happens because of lack of knowledge. Now, if I bring some of my clinical experience into just explaining the difference, when you have a child who can't speak and they've got significant intellectual difficulties and you have a care system in place which is established, you are more likely to get some comprehensible story behind the child's behaviors. Whereas if you have a child who's got autism or ADHD, who don't appear to have an intellectual disability, they're equally vulnerable. When I say equally, relative to a neurotypical child, but their behaviors can be misunderstood as opposed to someone with an intellectual disability. So that's where the misinterpretation, I think, happens in my clinical experience. If a child with autism has behaved in a certain way, they're more likely to think, okay, they are disinhibited, they're out of parental control, and whatever other reason that is inflicted onto the child. For example, sexualized behaviors. If a young person is engaging in unsafe sex, and a young child kind of being influenced by older adults, either in person or online activities, they tend to be blamed more, and they're scared to share any sort of abuse or threats that they face. So they sometimes use these behaviors as a self-protective strategy because they're scared somebody is going to do something more to their family. Therefore, they're going to just offer what they've been asked to offer. And so this goes on. And therefore, I think professionals have to take more of an ecological approach. It's not seeing the child itself as to what is going on, but we have to look very carefully into the system. And we also have to do that in a developmentally appropriate way. We have to have an understanding of the developmental stage of the child. By that, I mean not just the physiological development, but it is the emotional development and the intellectual development. You might see a 16-year-old with an emotional age of a 10-year-old. And if people don't understand that, you're going to look at the individual as a 16-year-old, expecting them to know what they're doing, but not always. I hope that kind of makes a sense. Now, the ecological approach is a framework where you study behaviors and development and health that actually emphasizes the interaction of that individual with the environment. And I think the individual and environment mutually influence each other. So it is so important that we understand the environment that that child or the person is living in, and what do their behaviors, what are they trying to communicate? And we talk about disabilities, as I stated, and it's all range of disabilities. And the form of abuse, it can be emotional, it can be physical, it can be sexual, and even neglect is, of course, considered as a disability that leads on to disability. And the behaviors, you might see them kind of aggressive behaviors or regressive behaviors in terms of bedwetting, soiling. And that can put pressure on the carers. And you're wondering, why are you doing this? And then there can be a conflict between the child and the carer. So that misinterpretation, now it's important. So the carers need to be educated well. So what behaviors indicate abuse, indicate trauma, which is really, really crucial. And sometimes you see an intellectually intelligent child not performing so well academically. And that in itself could be a subtle sign something is going on. What is going on for this child to not perform as well as they used to at school? And sometimes children, they have impaired capacity to resist or avoid abuse. So they are in a powerless position. And all these are causing the misinterpretation, especially when you see children and families who are more likely to be socially isolated. We're more likely to miss what is going on for this child because they do not have a supportive network, a trustworthy network where they can actually share their experiences. And a child, I think in my clinical practice, and that's what we do here, is need to have an advocate, an independent advocate who is there as a voice of the child. I think that helps a lot with getting the child's voice out without the influence of any responsible adult around them. I hope I've touched upon the aspects of the misinterpretation. Vaishali?
You did. Thank you so much. I'm going to have to ask you just one small question because we're running out of time. But if you can add one ethical consideration to balance the autonomy of a child with disability, with their vulnerability in reporting and disclosing abuse, what would it be?
I would say an advocate. I think providing a child with an advocate and giving them the autonomy to actually say their story as it is, and someone who could then share that as the child's voice, and taking time, really giving the child the time and to build trust and for them to be honestly being able to open up what has happened to them will validate their experience and give them this courage and confidence.
Yeah, absolutely. Thank you so much, Dr. Geetha. You kind of summed it up very nicely, and it was nice to hear a professional's perspective, the other side of the table. And it brought together some of the thoughts that were expressed by Sarita, by Dr. Binoo, Dr. Sasha. It all came together beautifully. We are getting a lot of commonalities in this thought process.
Yes.
So, yes, thank you so much again. And I will move on. Sad to leave you, Dr. Geetha, but yes, that's my job today. We move on to now Shampa Sengupta. She's a Kolkata-based activist working on the issues of disability and gender rights for the last 4 decades. A lot of experience and knowledge. A special educator by training, she is a founder director of Shruti Disability Rights Center. She identifies herself as a person with psychosocial disabilities, and she's also a primary caregiver. So I think she is bringing a lot to this panel, a lot of information, a lot of knowledge on all sides. Welcome, Shampa. Can we have you? I can't see her.
Vaishali.
Yeah. Hi, Shampa. Welcome. And shall we just jump in and start? So, because everyone's eager to hear what you have to say. So let me ask you my first question. How can intersectoral collaboration, we heard a little bit about this from Sarita also and the others about between police and child protection units, special educators, NGOs, etc., with families, of course, be institutionalized within the POCSO framework? What your experience has to say about this?
Thank you, Enfol, and thank you, Vaishali, for this introduction. This has been a really very exciting discussion. So actually, when I started working on disability rights in India, we didn't have any law. I mean, forget about RPD Act. We didn't even have the 1995 Act then. Of course, POCSO was not there. So I have seen these laws coming up, and I've been part of doing advocacy because policy work is my area of work. What we felt, I think the greatest thing about POCSO is it is firstly it's gender neutral. I think we must talk about it in the current scenario. So it's not only for girl children; it's for all children. Uh, But when POCSO came up, we had an earlier law. We had a 1995 Act which talked only about 7 kinds of disabilities. And now we have 21 kinds of disabilities. So things are changing very fast, at least in the legal side, I must say. As Dr. Geetha talked about, she mentioned UNCRPD's definition about disability. I just wanted to add that disability, even CRPD also says that disability is an evolving concept. So the concept is changing. And for me, it's very interesting also as a practitioner, as a policy level worker, when I think of POCSO when it was passed in the parliament, we got very excited because at least our disabled children were mentioned in it, and it was in a big like jump for us that we were getting into generic laws where disability is mentioned. And now we have the whole disability issue is something, so it's changed. The concept of disability changed now. So now the intersectoral work has became a totally new dimension now. I don't think it's only the judiciary, law, legal framework, police, the special educators, or the support person, because POCSO talks about support person for children with disability. So if any child with disability faces sexual abuse, he or she will get a support person to help through the whole process, the legal process of, uh, and that is something we need to think in a more comprehensive way now, because uh, uh, we have cases, I have seen cases where people with children who are blind, visual impairment, they are being abused within institutions also, within special schools also. We have seen those cases. It's very sad, but it happens. But we also have seen a totally different kind of cases where a child, an adolescent with autism, she was abused in a digital space. So, and it's very, sometimes it's very, as Sarita mentioned about importance of sexuality education, which is very, um, uh, uh, very interesting to know about Sarita's experience. But sexuality education somewhere uh, we have not thought of how to, because digital space has become a important area in life of all of us these days. So this young person, she's 17 years old, and she was chatting with someone uh, in a social media platform. So suddenly this person says, "Okay, see, I'm taking off my shirt. Why don't you do it also?" Like, and she couldn't understand the implication of it. Because the other person also did it, and he was a senior man, and this is a teenage girl. So what implications that have. She didn't understand. So I think when we started talking about in POCSO, when we talked about support person, these days I feel our work has become much more uh, complicated and much more important, because we now have to think of the digital abuse also. Those parts also have to be talked. And this is something I feel newer dimension. So things are changing. As I said, it's not like there is no static definition of, because forms of abuse are also changing these days, and it becomes much more challenging.
Yeah, yes, Shampa, you touched on digital space, etc. I mean, I'm shocked with the things that we see on TV or on the OTT platforms nowadays, where everything is out in the open, and I always wonder what's happening to those families if they put it on and there are children watching it, and adults are unaware that children are watching this, and then somehow we seem to be normalizing everything. So yes, so thank you for sharing this one instance, a sad, unfortunate instance, but something for us to understand and learn. So how is it that we are going to bridge this gap? I know you're talking about extremely hard work that we have to do now, but how do we bridge this gap in that criminal justice system? That probably children are not with disabilities are not that there's underreporting, okay, or there's not the likelihood of pursuing justice even from the families could be less. What is that gap, and how do we work on it?
Yeah, it is challenging, but we are working with many cases. There have been many reported cases also. Unfortunately, in our country, we come to know about a lot of cases, particularly on intellectual disability and young girls with hearing impairment, when the girl becomes pregnant because of abuse. It is absolutely true, and which becomes very difficult, because then this whole newer dimension coming of right to abort and right to have a child. This whole, of course, it's a child, so the decision becomes difficult, and for young women also, not just a child. Uh, but I think the criminal justice system, particularly after RPD Act. For recently, in last 1 year, I was invited to do training with West Bengal police officers. So they are also trying to understand how uh, things can be uh, implemented. They know the legal part. One thing is the legal part, one thing is the theory part. There is a law. Okay, RPD Act also, if you look at the Article 7 of RPD Act, it says that persons with disabilities, if they face abuse, the government will take action. But so that legal part is there. POCSO is, of course, there from many years now. And POCSO talks in detail about the support person, what kind of court system, the child-friendly court is talked about. But this, I think the information is not there. And I don't want to blame, like, okay, we went to this police officer, a police station, and we faced this problem. There are numerous cases I can talk about. I don't want to go into this because information is not there. I think one of the major break in problem in any work that we do on disability sector is there is not much information out there for the mainstream people, and mainstream people include the whole legal system, the police. So sometimes they actually call and ask that, what do we do? Because we have this case, we don't know. Okay, so POCSO talks about videographing, recording, video recording. but we don't have. So somewhere in a rural area in West Bengal, they will call up and say, but we don't have, we have a case, but we don't have equipment to video a child's testimony. So what do we do? And these are the things we face. These are the questions they ask. So one thing is there in the theory, and the second thing is we need to think about push the government about giving enough budget to have whatever equipment, whatever requirements are there. That is one thing. But I think the major problem is the information is not there. Even the support person who to call. So do you call a special educator or do you call a psychologist? Do you call a sign language interpreter when the case is registered? So police is like they don't know who to call because they are not trained on disability. So they don't have training. And I think I just say that we have a clause in Rights of Persons with Disabilities Act that everyone should get, like, it's mandatory. Everyone should get training on disability. And that is something, I think, something very, very important for us. On the other hand, I will say that special educators also need to learn about how to handle sexual abuse. Because a lot of time we have seen that they couldn't uh, detect when the change came. Yeah. So it's a like two-way process.
Yes, absolutely, Shampa. And anything that can happen has to have those two ways. We have to walk equal distances for things to happen. I mean, many a times especially in India. I don't know how it is on the other side, but we know that there is a distrust when it comes to people in uniform. People who are actually expected to implement the law. But we got to hear something very different from you just now, where you said that, people, some of them don't even have that education, or some of them don't have the means of putting things in place that they know there is a law, there is a rule that we need to follow. So thank you, Shampa. I don't know how I would love to go talk on, because there is so much information that we got from you. But I know that the timer is on. I'm going to have to stop my questions to you. I would just like to bring together everything that we've heard so far, which is such amazing information from everybody. Let me just put together some of the thoughts that have come to me, and then we will open this for question and answers. We have a lot of question and answers, I'm sure. So before that, some of the things that really stood out were what Binoo spoke about, 1098 RV, but then also we heard Shampa say that there is less information dissemination amongst our society itself, amongst our community, that, how do we put this 1098 across to everybody? How do we teach caregivers about, we heard from Dr. Sasha about the structured way in which their program, their educational program is put. So are we going to be able to do that within India? How are we going to educate people to understand, which Dr. Geetha also spoke about, to understand the distress signs in people? I mean, if people, neurotypical people, cannot openly talk about it, or do not trust their their families or their supporters or the people around them to talk about it, or their families are not able to interpret distress signals that are coming from the children, how are we going to then make people aware about the distress signals which can come from people with disabilities, especially because a lot of those distress signals can also be taken for behavioral issues, which we, at least in my case, we very often, see a lot of the sector talking about behavior issues rather than actually going down deep and figuring out where is that behavior coming from. And um, um, we wouldn't want it, but it's unfortunately it is about abuse and what are the steps that we need to take. We heard from Sarita. She spoke about how beautifully their special education, government special education school has taught them about self-advocacy. We heard from all of you others also about being an advocate, being a self-advocate, but we also heard, especially from Dr. Geetha, about how there has to be another advocate for the child. And probably the thoughts come to me is that how do we put all of this together? How do we make this happen? That is probably the question in front of all of us in the sector, in front of Enfold, and people like Enfold who work in the field of sexual abuse or abuse. In our sector, NGOs who work with families, with children who do have these kind of issues, who have disability, who have intellectual disability, and we see them all over. We need to be speaking up, and we need to stop it, and we need to just get there. I'm guessing that this panel would have given a lot of food for thought for everybody, putting together their mind. And yes, so thank you so much. Thank you, Enfold, for having me here and being able to, giving me an opportunity to moderate this. Let me thank Vijaya, who did bulk of the work for me. I just am the face over here and the voice who's talking, but she put together the panel, the questions, and she brought everyone together. So thank you. Personal thanks to you, Vijaya. I had been very hard on her. And yes, so we come to a close to this fireside chat, but I hand it over to Anala now to go ahead with the questions that our audience must have posted or would like to ask.
And yeah. Good evening and thank you, Shampa, Geetha, Sasha, Sarita. Thank you for the lovely, lovely input. Binoo, thank you so much. Right. So we've opened up for questions. Would any of the odd questions from the audience, please, to any of the panelists? Meanwhile,
I think Vijay, sorry to butt in, but I think there are some questions on the chat. I just happened to see, but maybe it would be good for you to open.
Yeah. Shampa, yeah, there's one Shampa. Even we do not speak the same language and on to training to deal and engage with these kind of cases. Yes, please post your questions there. And are there any questions? No, there's not. So while the audience is getting ready to formulate their questions, so we at Enfold, the Suvidha kit, you see the picture at the back, you have the Suvidha kit, which is a kit that is used for training caregivers, parents, teachers, and teachers. That's where our trainings are focused. And to talk about sexuality education, and most of the times it's caregivers and parents and teachers are really not very comfortable with all these words around sexuality education. So I think the first 12 hours, or I would say the first 6 hours, goes in just bringing down those barriers. Sarita, you're really privileged to have that much earlier in life, right? And sexuality education starting that early. So one of the, we have 5 different modules, but the one that we can relate to child sexual abuse is the rules for touching, for rules and boundaries for touching others, right? So here, while talking about rules and boundaries for touching others, what we focus on is permission, asking people permission whether they can touch, saying no, so developing agency, right? And so this therefore empowers the child to talk about empowers the child to talk about whether the child wants to be touched or not, or whether the child can touch or not. And if there is, and the other more important thing is talking about, unfortunately, or fortunately, any kind of the sexual touch is a pleasurable one, right? It's a good feeling, but it's not a safe one, right? So it's unsafe. But therefore, there's a confusion over there. So while we speak to the caregivers and parents, this is what we make them aware of. And there is a whole section where we talk about body image. Our body is ours. Sasha identified with that totally, right? Talking about the body, being proud of our body, and the functions of the being open and talking about about the private parts, giving it the names that it should be given. The parents and are made very, very aware of this. Just we had a training the other day where the real weird words were used for the private parts. So there is a lot of misinterpretation. There is a lot of miscommunication. So even if the child is talking about inappropriate touches or inappropriate behavior, it'll be missed, right? Yeah. So with that, and the Suvidha kit is available, and I think we will put up our IDs and our contact details here. Please do reach out. Do reach out if you all want trainings or the kit. Anyways, questions. So there are questions that have come up.
Yeah.
Josephine, are there any systematic interventions initiated to address issues of CWD online? And this would be, yeah.
Online issues.
So, I'm sorry?
This is about issues they face online.
Online, yeah.
It's online, yes.
So,
this is for Shampa, this question.
Shampa?
Yes, it is, yeah. If Ms. Shampa can talk about it, it will be great.
So do you want me to answer that question?
Yes, please, go ahead.
Yeah. Can you read out the question once more?
The question is, are there any systematic interventions initiated to address issues of children with disabilities online?
I don't think there are like there are organizations, there are CBOs or DPOs who are working on safety of children with disabilities, both online and offline. But if you're thinking of a systematic issue, means the government initiative, still we don't find anything very specific. We of course have Childline. We also have a Kiran. I think the Kiran helpline name is changed now for any person with disability. But for safety online, we don't have any specific one. I am just adding one more point here because I saw that was not a question but a comment here that there is a very, very, very big difference between rural India and urban India, because still now in India we do have, like, most of the NGOs or disabled people's group are working in the urban areas. So that is one of the major problem, and we work in the field, and we have seen many cases of violence happening in the rural areas also. Unfortunately, the we like what Sarita said. She was part of a government special education system, and we don't have there is a lack of it. So until and unless we advocate for something like that here, it's very difficult to reach out to vast major number of just persons with disabilities, uh, children with disabilities, because yeah, in India, the largest population, disabled population, is in rural areas, but there are very few services to it. So I think I just wanted to add that, and that is something as a collective we can advocate with the government, that to take more action where rural population is there, so that we can work in those areas.
Thank you. There's another question for Sarita. It's from Shlesha. It's that, do you use social media? What type of content do you like? Do you face any negativity? And if yes, how do you navigate through it? And also, if you have any other tools that you use that you would like to talk about.
Yes. So the first thing is that it depends of what sort of content I look, but if we are talking about this subject, there's a doctor that she has a YouTube channel. I look at her videos. She talks about skin subjects and also about the periods, and in general we watch videos together, and there are books. Sorry, these two books, The Care and Keeping of You. Let me just go back a bit. There we go. These books, so we read. So one of the first books was this book, and the second is this book. So the difference is that this is for younger girls. It talks about the general hygiene, and this one talks more about your changes in your body. So these are the two books that we read together, and yeah, these are the two books.
There's a question to Dr. Binoo. How do you open conversation on pleasure and safety to your child?
See, the thing is that you don't have to open a conversation. You just have to bring the child into the conversation. So, like I told you, that what the method I used was that every day I would allot a particular amount of time, maybe even if it is 5 minutes, 10 minutes, to figure out what she did the entire day and whatever she can, come out with. And then if there is nothing much for her to tell, you slowly manipulate the conversation in a way to give the message what you want to give through a story or through an example, even if it is, cooked up, made up. After all, we tell stories to our children about, you know, what the lion said to the jackal, and what, I mean, these are all not true. So you can just, scale it up a little, that, I have a friend and a daughter had this problem, or the son had this problem, or this is what so and so did. Do you think they did the right thing? I think it was not correct. Even if it was fun, this is where the boundary should have been drawn. Like that, you just bring the child into conversation so that the child is comfortable with you on the subject. So when they need to approach you, they'll be able to approach you comfortably. I mean, this has been my way of putting things across.
Thank you, Dr. Binoo. So basically creating a safe space, a
A
space
safe
where,
space. Yeah.
where there is
Because
a
the moment you
sexuality.
approach, because the moment you approach the child will clam up, because they do not know whether it is to be, if it is safe to tell the mother this or the parent this or not, whether they'd be ridiculed, whether they would not be understood, whether there's going to be retribution, whether, if we do not know what the child is thinking.
Geetha, you want to ask a question? You raised your hand.
I just wanted to mention, can you hear me?
Yes.
I wanted to raise the topic. It came to my mind about female genital mutilation. Is that a practice that happens in India?
No. Vaishali, would you like to answer that?
No, I think Shampa would be better, but from the news that I have heard, yes, there is.
Okay. No, because that I would like to just for the audience also to think about, that some things that are considered as cultural practices are very traumatic and classified as abusive towards the child. However, it's going to be hard to prove that either way. And we should not assume that it is okay for a child to go through that. And I just wanted to mention the other thing was the sexual development of children, young people with disabilities. There is a natural need for them too. Therefore, just assuming somebody is being abused in terms of having sexual relationship with someone also should be done cautiously. And I would recommend a film called Margarita with a Straw. Was done with Kalki Kochlin, who is a disabled young woman. And the mother herself misunderstands her because she has sexual desires. So it goes both ways. I think there are normal where we have to kind of normalize their physical needs. They're no different to anybody without a disability. They're going to have the same needs.
If I may, Vaishali.
Please go ahead, Sangeeta.
Yeah, I just wanted to add to that female genital mutilation. Yes, it is a practice in a small community within India as well. But what is more rampant, I think, at least in India, is the mutilation of the genitals of the intersex child.
Oh.
Yes. That requires more activism, awareness, all of that, which Enfold is taking up in the form of medical and psychosocial guidelines for the medical fraternity, so that they can support the child, the newborn child or the small baby, and their parents and the family, because eventually it all boils down to the prevailing norms and beliefs in the society. And many a time the doctors are also a part of that belief system. So we need more education, awareness building, and it's slow and steady, and perseverance gets us there, gets the job done. Yeah. Thank you.
Thank you.
I think Sarita wanted to say something.
Sarita?
I saw her.
Yeah.
Yes. So we're talking about safety. That's something that's something that I fully agree on. But we also have to talk about pleasure, because I mean, knowing me, you can't put two teenagers in a room and be 100% sure that they will play chess. So yeah. So my point is, it's good to talk about that, but also talk about pleasure and about relationships. So just keep this in mind.
Thank you, Sarita. As always, this was one thing that you told me the last time you met me. Yes, and that lovely, refreshing thought. Yes, there is abuse. Yes, we have good touch and bad touch, but it's also very pleasurable. Sangeeta, your hand is raised. Do you want to say anything? I guess that
I
was.
just wanted to also bring out that we prefer to use the word safe touch, unsafe touch rather than good and bad, and that we also don't want to say don't let anyone touch you there, because it's not really in the child's hands, but do say no if you can, go away from the person and do tell a safe adult, which the panelists shared very well when the daughter came and told the father about the abuse. Yeah.
Thank you. Thank you so much. Thank you all for this lovely, lovely interaction. And there's so much of information that we've all shared. And from Unfold, there have been questions about the Suvidha kit. It's available in as of now in English, Malayalam, and Kannada. Hindi, Marathi, and Tamil is on the way. Right? So please do reach out to us, and we will be able to just email us, and we'll be able to give you the information that you require. With that, Sangeeta, do you have something to say?
No. I'm just waiting for my flight to be called.
Okay, so see you soon. Yeah. Thank you, everyone. Thank you, love. Thank you, all panelists, and Vaishali, and all the audience here. Lovely evening spent. Bye-bye.
Thank you very much.
Just 1 second. Can I please come in?
Yes, please.
Thank you so much, everyone, for being part of the Global Coalition. Yet again, we had so many people who joined the Global Coalition, and much thanks to all the panelists. I think the diversity of the panelists was so rich. So thank you, all of you, for coming. And special thanks to our lovely Sarita for being the voice, representing the voice of so many teenagers, and for stressing the importance of sexuality education. I think a lot of caregivers and lot of teenagers will take inspiration from you, Sarita. More power and strength to you. For people who are not the members of the Global Coalition, please visit our website. There is a page on Global Coalition. You can fill the form, become a member so that you can access resources. And to organizations, please, we would love to collaborate with you and create something together, because the Global Coalition is a collective effort. It's not just an Enfold's effort. So do come in and, let's create something together, either resources or be a part of the Global Coalition meetings. And some of you also asked about how to talk to children about safe touch, unsafe touch, how do parents talk about it. So Enfold has created a lot of resources. You can go to our resource page and look up. We're also creating online course for parents, for caregivers, for educators on how to talk to children under the age of 8 years, how to have these conversations. So please keep it. We will be sharing the online course as well. And as Dr. Sangeeta said, our objective is also create a common vocabulary which is rich, which is inclusive, and which does not place a responsibility on the child, but on the community, on the adult, for their safety. So thank you so much. We would see you in January, and we'll send out the details for the next meeting soon. Thank you. Have a lovely evening and night. And thank you, Vaishali ji, again for moderating. It's so beautiful. Thank you so much.
Thank
Thank you,
Thank
Vaishali.
you.
Thank
Thanks,
you,
Sangeeta.
Anila.
Bye-bye.
Thanks,
Bye.
Vaishali. That was wonderful. Beautiful.
Khushi, can you please end the meeting?
I couldn't hear you, Sanjana.
Can you end the meeting for everyone? And thank you to the ISL
Renuka.
people. Thank you so
Thank you,
much,
Renuka.
Radhika. Thank you so much, Renuka, for doing the interpretation for us, like always. Thank you.
Deepika. Yeah, you're there.
Deepika. Sorry.
Thank you,
Deepika
Renuka.
and
Thank you, Deepika. Thank you so much. As always, you're always there for us.
Okay, thanks everyone.